Morning, everybody. The topic we are going to discuss today, diabetic ketoacidosis. After a few years, when you become doctors in hospital emergencies, this is one of the most challenging and most difficult problems you are going to encounter, but it will become very easy if you understand the basics. That's the purpose of this lecture. Now, diabetic ketoacidosis. It's an acute complication of type 1 diabetes. Type 1 diabetes, the genetically programmed autoimmune disease with extensive destruction of beta cells, and the patient has to depend on daily insulin injection. So, if the control is lost, type 1 diabetes uncontrolled, then only it leads to this perilous and life-threatening condition called diabetic ketoacidosis. And moreover, it covers a number of competencies I have enlisted, and it touches many more competencies, diverse competencies. So cutting across the boundaries, which is hallmark of integration as recommended by National Medical Council. First, why uncontrolled diabetes leads to excessive ketone body generation. So, diabetes leading to excessive ketone bodies in the circulation. Second, why excessive ketone bodies lead to acidosis. So, this complex problem I'm going to split in these two parts. And ketone bodies, just to mention, these three compounds are called ketone bodies. The first two are called true ketone bodies. We are coming to that later on. Now, just an overview. Glucose cannot be utilized. Diabetes, as you all know. So, alternate fuels, fatty acids. So, fatty acid level rises. Fatty acids converted to acetyl coenzyme A, we are going to see. And these acetyl coenzyme A are generating, they are channelized into production of ketone bodies. So the first one we are going to consider why there is rise of free fatty acid in the circulation when the diabetes gets uncontrolled. So this is an important statement. Source and determinant of free fatty acids, okay, levels in the blood of triglyceride stores in adipose tissue. Adipose tissues में बहुत बड़े stores होते हैं, depending upon weight of the person, and they are continually being synthesized and degraded. The second process is called lipolysis, and it's a dynamic steady state. TAG synthesis ka rate, it is equal to rate of lipolysis, that is breakdown of triacylglycerol. And the enzyme responsible for this is called hormone sensitive lipase, this one. Now consider their rates are normally equal to each other. But supposing if the rate of lipolysis increases, what I mean to say, hormone sensitive lipase, अगर इसकी activity increase हो जाए, then more fatty acids will be produced. That is what happens in diabetes because insulin is a potent inhibitor of this enzyme, hormone sensitive lipase. So diabetes में इंसुलिन की कमी या एब्सेंस है, so hormone sensitive lipase will become overactive. So the rate of lipolysis exceeds rate of synthesis. As a result, more and more fatty acids are generated. And as you can see here, fatty acids are normally recycled. And now much more fatty acids are generated than can be recycled, and the excess leaks into the circulation. So free fatty acid level increases. So that is the first part of the problem. Here, in a more explicit manner, I have shown insulin inhibitor of hormone sensitive lipase. One more point. It's a stressful state, isn't it? Diabetic ketoacidosis, as you are going to see in the clinical case. So stress के अंदर the stress hormone epinephrine, norepinephrine also, they are stimulator of hormone sensitive lipase. So hormone sensitive lipase activity rises because of two reasons, epinephrine का के through and insulin mediated. Lack of insulin and more of stress hormone. So we have considered the first part, pre-fatty acid level in the blood are rising. Then why excessive acetyl coenzyme A? It's very simple. All of you know कि fatty acid के degradation से बनते हैं acetyl coenzyme A. Now why acetyl coenzyme A leads to ketogenesis, means ketone bodies production. Let us understand magnitude of the problem. Acetyl coenzyme A can enter TCA cycle. Acetyl coenzyme A can also generate fatty acids. Acetyl coenzyme A can also generate ketone bodies. So why it is channelized into ketogenesis? So now we are coming to the third part. Because पहली बात तो एसिटाइल कोएंजाइम में ज्यादा जनरेट हुआ. Second, TCA cycle is either hampered or blocked in uncontrolled diabetes. Fatty acid generation is also hampered or blocked. So you can see more explicitly in this figure. Acetyl coenzyme में TCA cycle block है, fatty acid synthesis block है. So nowhere else to go. It goes into ketogenesis or cholesterol genesis. But at the moment in acute condition, more ketone bodies, that is more important. Now the question, you see, in course of this lecture, I will be leaving you with certain questions. That is basis of self-directed learning. Please try to solve them yourselves. Why TCA cycle is blocked in diabetes? I am giving you two questions. Which is the most important regulatory point in TCA cycle? The first step, oxaloacetate acetyl coenzyme A condensation to form citrate. And what happens to this step in diabetes? To give you a hint, what happens to oxaloacetate concentration? Decreases because as oxaloacetate goes into gluconeogenesis. So oxaloacetate concentration decrease ho gayi. Oh, I've told the answer. All right. But anyway, expand upon it because there is a lot more to that also. Second, why fatty acid synthesis decreases? Because the enzyme is, regulatory enzyme is acetyl coenzyme A carboxylase. What is the effect of insulin on this enzyme? Stimulatory. So no insulin, this will be, anyway, expand yourself. So just we will touch this table, this figure. More acetyl coenzyme A, more are the generation of ketone bodies, acetoacetate, beta hydroxybutyrate, and acetone. So they are rich in metabolic energy. The first two. Acetone is not. It is exhaled in the breath, as we are going to see in the clinical case. The typical fruity odor is seen. Anyway, later on. Now, one mistake which I have seen most of the students making, they say that ketone bodies are toxic products of metabolism. Absolutely wrong answer. Rather, they are very useful. They are rich in metabolic energy. You can see here acetyl coenzyme A, which goes into TCA cycle. So they are harmful only when in excess. Though plasma level is this much, urinary excretion is negligible. And the true ketone bodies, I have said, the first two, acetone, acetoacetate. Okay, so they are carried to extrahepatic tissue to produce energy. Acetone is exhaled out. It is unmetabolizable. So isn't it interesting that the liver synthesizes ketone bodies, but it does not use? All other organs, extrahepatic tissues, they can use ketone bodies, especially central nervous system, etc. Anyway, besides the point. So ketosis, now we are coming to the second part. Second part, this we have answered totally, the three parts में हमने answer कर दिया. Second, why excess ketone bodies lead to acidosis? And acidosis is something you people all know, it is life-threatening. Why excess ketone bodies lead to acidosis? Ketoacidosis, we call it diabetic ketoacidosis. Two components, ketonemia. The serum plasma level of ketone bodies increases and more finds its way into the urine. Okay. Ek, when it rises, when excessive production is there, then only ketonuria will occur. When the level rises much more above, maybe 20, 40, then only. Actually, some books they mention when it goes above 70, because increased synthesis is matched by increased utilization also. Anyway, I'm sorry, digressing a bit. So ketoacidosis is this one. Why it is dangerous? Henderson-Hasselbalch equation will try to understand through this. pH, pK is a constant, you all know. Log of base concentration by acid concentration, and the predominant extracellular buffer being bicarbonate buffer. The base constituent is bicarbonate, acid constituent is carbonic acid. So acidosis, excess एसिड जनरेशन, एसिटोएसिटिक एसिड ज्यादा H+ available होगा. They will react with the bicarbonate ions. As a result, what will happen? The concentration of bicarbonate will decrease, and this will result in pH fall. So this is called metabolic acidosis. Whenever the primary defect is decrease in the bicarbonate concentration, it is metabolic acidosis. One more point. Bicarbonate will react with H+ to form H2CO3. So fall in bicarbonate is accompanied by rise in carbonic acid concentration, because bicarbonate H+ से मिलकर H2CO3 बनाता है. And here lies an important point. Carbonic acid is equilibrated with carbon dioxide. Carbonic acid PCO2 के साथ इसका equilibration होता है. So more H2CO3, it will degrade into carbon dioxide, and more, carbon dioxide zyada hoga. So to exhale it, the patient will breathe heavily, fast and deep breathing. This is called Kusumal breathing, and we are going to see more about it. Kusumal breathing, why that happens? Because the net result of the sequence of events is increase in carbon dioxide. So hyperventilation hoga, so that PCO2 falls, and H2CO3 level, which had increased, it is restored to the original level. So that is the compensatory mechanism, this Kusumal breathing.